Hey guys, welcome back to my channel. It's Liz, and today is going to be all about how to present report super quickly in acute situations such as RRTs, codes, or when you're paging a doctor and just trying to communicate a whole situation quickly and efficiently. This is something I have seen a lot of new nurses, even senior nurses, struggle with because you have so much information and you're just not sure what aspect of it to present, what's important, and what they actually need to know, and you want to do it all in about under 30 seconds. So it takes a lot of practice. So hopefully this video will be helpful for you. If you're in those situations, make sure to stick around and I'll show you my steps to creating a super simple, succinct report for acute situations. So I feel like in nursing school, they taught you how to give regular traditional report with a patient, and that goes over everything. It's very comprehensive. You're expected to have at least 5 minutes per patient, but I was never taught how to give report in acute situations. So that's when the RRT or the code team shows up and you have to really quickly explain, this is the situation, what I've done, and this is what we're with right now. And I struggled with that as a new nurse, and I've seen so many other new nurses struggle, and I think it's such a shame because this is such a good skill. It's easy to learn, you just have to practice it a little bit, and there's a really simple recipe, there you go, for how to present this information. Okay, so step number 1, we're going to pretend in this instance that you are calling a code or a rapid response, something where it's a team of people who aren't necessarily very familiar with your exact patient. Now, if you're paging a provider, this is not the step you're going to start with because you're going to assume they already know this information. Hopefully, if you're paging them, they know who the patient is, how old they are, and why they are there. But for the case of this right now, we're gonna say, this is your RRT you're calling, and these people are showing up and they don't really have any information because when you call those things, people show up and they don't know they are just responding to the situation. They haven't looked them up. They don't know anything about your patient at all. So you are going to give them the age, that I always just say the gender, sometimes it's not clear, their admission diagnosis, and any very pertinent medical history. So I say very pertinent. Who cares what crazy surgeries they've had before or if they are depressed or anxious? I mean, we care, but in this instance, we don't. You want to know, like, if they are having respiratory problems, do they have COPD? Do they have asthma? Are they in congestive heart failure? These are things that are going to affect what you are doing. Pick like 1 or 2. That's all. This is very, very brief. You're going to want to keep these all very succinct. So you would say, for an example, this is a 52-year-old woman admitted with pneumonia. She has a history of COPD and she's in respiratory distress. And by telling them that she has COPD, you're letting them know that she has a baseline respiratory impairment. So they're going to need to keep that in the back of their mind since this is a respiratory issue. And they may need to be more aggressive in the treatment that they provide. So now we have identified the patient and why they are here in a very, very brief history. Step number 2, we're going to talk about why you've called everyone here today. And this is where you would start if you were calling a provider because they obviously already know the information we just talked about. So in this, you're going to give the situation, why you are calling, when it started, what physical assessments findings you have found, any vital signs that are pertinent, and just a brief clinical picture. Are they getting better or are they getting worse? Usually if you're calling them, they're getting worse. And again, you're just going to want to make it very short, sweet, to the point. So in our example, we would call, or in our RRT, we would say this patient is experiencing increased respiratory distress, noted by retractions, accessory muscle use, nasal flaring, tachypnea, and a decrease in oxygen saturation. She was at 95 and now she's hanging out at 92. This has been going on for the last 2 hours with a steady decline. She's afebrile and her blood pressure is 120/86. Letting them know, hey, her blood pressure is still stable. You could throw in her heart rate. So clearly we're looking at this whole picture and it's not great. And the third thing, we're going to talk about what we have done and if it has helped. For example, did you provide PNPD to the patient? Did you sit them up, reposition them? Did you give them some pain medicine to see if you could ease their work of breathing by making them more comfortable? Anything that you've thought of that you've tried, give them a very brief synopsis. So in this case, you could say, we've attempted repositioning, we've provided PNPD with a productive cough, we've increased her oxygen from 2 liters, now we're at 6. However, we have seen no improvement. And there you go. That will do it. So now I'm going to show you what that sounds like all together. We're gonna wanna keep it like under 30 seconds and just present it, the pertinent facts in an easy, clear way. This is a 52-year-old female admitted with pneumonia, history of COPD, no known drug allergies. Always good to throw their allergies in there. Over the last 2 hours, I've noticed an increased work of breathing as noted by nasal flaring, accessory muscle use, retractions, a decrease in her oxygen from 96 to 92%, tachypnea at 20, and an overall appearance of fatigue. Over the last 2 hours, she has been steadily declining. I've attempted to reposition her, provide POPD. I've increased her oxygen from 2 to 10 liters, all of which was not helpful. And there you go. That is basically all they really need to know. Now, this patient could be very complicated with a million other things, but that's what they want to know. Who is this person? What major medical history do they have? What is going on? What are their vitals? What physical signs are they showing? What have you done? Are they getting better? That is the general rule of thumb for giving a quick acute report. Now, this is something that definitely comes with time. So I found in the beginning of my nursing career, it was very helpful to identify the major things wrong with my patients when I first showed up. So this is morbid, but I used to always think, what if something happened to them? What would I say? So I would notice, like, this is a person with, if they're in liver failure, that would be my thing. Like, liver failure, they're not going to metabolize meds well. Okay, kidney failure, we really need to be on top of that and think about that and how they're going to tolerate fluids in an emergency, how they're going to tolerate meds. So just think, like, what are your patient's main complications? Keep that in the back of your mind and sort of anticipate what could go wrong so you can watch for those signs and symptoms, like based on their admitting diagnosis. All right, guys. Hopefully this was helpful for you. If you did find it helpful, make sure to subscribe below. I'm Liz. I do videos on being a nurse, some nursing tips. I vlog my nurse practitioner school experience, and sometimes I do videos on my babies and baby things because I think my baby's cute and I love her. So yeah, also follow me on Instagram because I do polls there on kind of what you guys like to see and some additional tips. All right, hope this video was helpful, guys. I want to hear from you today. Did you learn about this in nursing school? Also, what kind of report is the most challenging for you to give? And just a random question, what color is your stethoscope? Because I'm looking for a new stethoscope and I'd kind of like to know what's cute. All right, thanks for watching, guys. I hope you have a great day. We'll see you next time.